Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. A promising future in the battle against COVID-19 as Nigeria receives Russia's coronavirus vaccine. Nigeria Association of Resident Doctors (NARD) declares nationwide industrial action from Monday over non-payment of COVID-19 hazard and other inducement allowances. ASU lists conditions for reopening of universities, insists on replacement of IPPIS with UTAS and improved infrastructure for research. And Italy's former Prime Minister Silvio Berlusconi in hospital in Milan after diagnosed with the coronavirus. Welcome everyone to the program. Nigeria has received the coronavirus vaccine from Russia. Russia's ambassador to Nigeria, Mr. Alexei Shabashin, handed over some of the vaccines made by the Russian government to the Minister of Health, Dr. Sergei Hanire, during a visit in Abuja. A statement by the Director of Information at the Ministry of Health, Mr. Olujimi Oyetomi, says Russia also submitted, along with the vaccines, an aid memoir which explains the details of the vaccine to enable the Nigerian government study it further. Meanwhile, the Minister of Health notes that Nigeria has been participating in a series of knowledge exchange and contacts with different research bodies and countries to find solutions to the COVID-19 challenge, and that it had contacted the embassy of the Russian Federation in Nigeria for right of access immediately the Russian COVID-19 vaccine was announced. And Africa has recorded over 1 million recoveries of COVID-19, while the continent has lost 30,620 people to the disease. According to the Nigeria Center for Disease Control (NCDC), between August and September, the number of states with over 1,000 confirmed cases increased from 10 to 12. And the FCT. On case fatality ratio, the Presidential Task Force on COVID-19 says this has consistently remained at 1.9%, indicating improved case management, resulting in fewer COVID-19 deaths. Last night, the center reported 124 new cases in 12 states at the FCT, and 21 deaths were reported in Nigeria. Lagos reported the highest number of new cases at 42, followed by the FCT. Plateau State did not report any case. The NCDC says the 20 deaths were recorded in Kaduna in the past month and was reported by the government, while 1 death was recorded in Anambra State. 188 people recovered from the virus in the last 24 hours in 11 states and the FCT. Plateau recovering the highest at 72 there, followed by Ogun, the FCT, Anambra, Kano, Edo, Kaduna, and the others. States like Jigawa has not reported a case in the last 49 days, Kogi State in over 2 months, while Yobe State reported a case last 35 days ago. The Academic Staff Union of Universities, ASU, has given conditions for the reopening of universities, which includes the unveiling of the University Transparency Accountability Solution, UTAS, in place of the IPPIS salary and emolument issues, among many others. Now, the zonal coordinator of ASU, Owerri Zone, Mr. Uzo Onyebinama, while briefing newsmen at the Michael Okpara University of Agriculture, Mudike Umuahia, harped on the need for the government to attend to the prevailing issues. He says, in relation to the COVID-19 guidelines, public universities cannot reopen with the current infrastructure in place.
We must, however, emphasize that UTAS is far more than just an alternative to IPs, which does not respect the nature, structure, and character of the Nigerian university system. As we speak today, our members in various universities across the nation are suffering various challenges arising from the deployment of IPs in the universities. For instance, Michael Okpara University of Agriculture, Mudike, where our members are owed 4 months' salary. At the Nnamdi Azikiwe University, over 200 members have not been paid for over 7 months. The situation is the same across all federal universities, including the Federal University of Technology, Owerri, Futo. Both July and August 2020 salary are outstanding for lecturers in all federal universities. Our state universities suffer worse fate. No state university in Aso-Owerri zone receives complete salary as and when due. We hereby alert the Nigerian public that public universities cannot reopen due to inadequate infrastructure in relation to the COVID-19 guidelines. We are therefore calling on all well-meaning Nigerians to prevent on governments across all levels to conclusively address all outstanding issues in the February 2019 MOA, live up to its promise to adopt UTAS, and provide urgently the needed revitalization fund for improved infrastructure for teaching, research, and welfare of students.
The Nigerian Association of Resident Doctors, NARD, has declared a nationwide industrial action beginning from Monday, September the 7th, to protest the non-payment of COVID-19 hazard and other inducement allowances. A communique signed by the President, Dr. Sokumba Aliyu, at the end of a virtual Executive Council meeting, notes that the federal government has repeatedly failed to honour the agreements reached with the doctors during previous meetings to forestall the industrial action. The statement says the leadership of NARD is asking all its members nationwide to down tools pending when government releases funds for the residency training program and to clear up the arrears. It will be recalled that the doctors in July this year issued a 21-day ultimatum to the federal government to address the issues raised. An ultimatum, they say, elapsed on the 17th of August. Well, we have the president of the association, the Nigerian Association of Resident Doctors, Dr. Sokumba Aliyu, and he joins us via Skype. Thank you for joining us on the program. Give us an idea of what the government must do, and that is do immediately for your association to call off the industrial action to begin on Monday.
Thank you very much for having me. You will recall that on the 15th of June, we embarked on a nationwide strike that lasted just a week, which we suspended because of the appeal from well-meaning Nigerians, as well as promises made by the government that the strike be suspended and our concerns will be addressed. Fast forward 10 weeks after, all of this have remained a mirage. And so we have decided that at this point, we cannot continue but embark and resume the suspended strike. What we, in essence, want the government to do is to ensure that we are enrolled for the group life insurance. We have continued to clamor that we want our members enrolled and the death in service benefits to those that have died on duties paid. We also want the promised money that the Speaker of the National Assembly has ensured it's captured in the budget for the residency training funding be released. Since the promise was made about 2 months ago, the money has still not been released. Our program is a time-bound program, and we have to finish our program in good time. So we want the government to do what is needed, and release the funds so that our program can continue. And we also want the COVID hazard allowance, which the government had promised that we will pay for 6 months to be paid. As it stands now, only 2 months, that's for the months of April and May, has been paid to some institutions, and for the rest of the month, it's still pending, and most other hospitals are even yet to get even for 1 month paid to them. So basically, we want our residency training funding payments commenced. We want the life insurance enrollment commenced, and the death in service benefits to those that have died on duty paid. And we want the COVID hazard allowance. If government can no longer continue to pay the COVID hazard allowance, we want our 5,000 naira monthly hazard allowance reviewed from what it is now, because of course we all know 5,000 naira is no longer tenable as hazard allowance at this point in time in our state of nation. And you can agree with me that 5,000 naira, which amounts to just around $12, is not any amount anybody will take to anywhere to even procure the drugs we need as a prophylaxis for the diseases we encounter in the course of discharging our duties. So these are our concerns, basically.
And we do hope that the government is listening. We would like to thank you, Dr. Lee Sokumba. Thank you for joining us on the program.
Thank you for having me.
Well, the Nigerian Medical Association Calabar branch has confirmed the release of Dr. Vivian Otu, pediatrician at the University of Calabar Teaching Hospital, who was kidnapped on the 28th of August. Now, the state chairman confirmed this to Channels Television shortly after her release. Her kidnap had generated reactions by the NMA and Medical Women's Association in the state, calling for her immediate release, and also members withdrew their medical services, expressing worries over security of medical doctors in the state. Meanwhile, it's also good news in Ondo State, where the Chief Medical Director of the General Hospital, Idoani, Ondo State, Dr. Olufemi Adeogun, who was abducted alongside two others, they've all been rescued. The spokesperson of the Ondo State Police Command said the victims were rescued by the combined efforts of the police and other security operatives who moved into the nearby forest for operation. Now, several independent surveys have shown that while a huge number of the population are aware of COVID-19, very many of them believe that they cannot get it, and this is among several other reasons. We have Dr. Garba Abari, the Director General, National Orientation Agency. He joins us from Abuja studios. Thank you for joining us on the program. All right, we're hopefully going to try to get a hold of Dr. Abari shortly. But let's take you to Imo State, where our correspondent Itokwe Kuteyi brings us this update on the collaboration with the COVID-19 task force and INEC in the forthcoming elections there.
The Independent National Electoral Commission, INEC, has fixed 31st of October 2020 for the Imo North Senatorial District by-election to replace late Senator Ben Uwajimogu, who was earlier representing the Senatorial District at the Upper Legislative House. And for this, the COVID-19 task force in Imo State says is collaborating with INEC to ensure that all COVID-19 protocols are being adhered to during the campaigns and during the election proper. The chairman of the COVID-19 task force in Imo State, Professor Morrissey, disclosed it at a briefing in Owerri, the Imo State capital. He also complained about the complacency of indigents to the COVID-19 protocols in Imo State.
That there is some laxity across the nation as to observance of the guidelines that were given earlier about COVID-19. Why that is very sad, in the sense that the virus has not gone away. People are also dying. At this stage, we are actually appealing to people or reminding them for their own personal safety that they should observe those guidelines, even if others are not observing them. What do I mean? Even if you go into a crowd and people are not wearing face masks, you should take personal responsibility to protect yourself from possible contamination and then having been infected by others.
With 529 confirmed cases of coronavirus disease in Imo State, we hope that political parties and all stakeholders will adhere strictly to the COVID-19 guidelines to contain the spread of the virus during the election. From Owerri, the Imo State capital, Itokwe Kuteyi for COVID-19 update.
We have more updates when we return. Do stay with us. Welcome back to the program. We have joining us via Skype Dr. Garba Abari, the Director General, National Orientation Agency. Thank you for joining us on the program. I'd like to begin by asking about the strategy of the agency in educating people on COVID-19, especially how far it has gotten to the grassroots.
Well, thank you very much. I think the strategy that the agency has deployed is one that is actually known to almost everybody. At the commencement of the risk communication messages, immediately after the index case was reported, what the National Orientation Agency did was to first and foremost worked hand in hand with the NCDC and they developed messages in Hausa, in Yoruba, in Igbo, in Fulfulde, in Efik, in Pidgin, and of course in several other languages, talking about the nature of the disease and its manifestations. This is the first strategy that was deployed. At that stage, it was only at the level of creating awareness about the disease and its realities and its symptoms, and what to look out for, and how to remain protected, and in so doing also protect others. Remember, at the very beginning, the general feeling was that it was a disease that was imported into the country. Of course, it was imported into the country, but the fact that it was imported into the country did not make it did not make it a disease that would not afflict others, the citizens domestically. So the first strategy was to deploy messages in different languages about the nature, about the realities, about the manifestations, about what to look out for. And this is what we did. And then in the course of creating awareness, which was actually done in line with so many partners, especially the media, the NTA, the radio corporations, the Federal Radio Corporation, the state radio corporations all over the country, and of course using our community mobilization officers. When the disease got to the community transmission stage, then it became clear that a new strategy had to be deployed. And this is the stage where the National Orientation Agency, again in liaison with the Center for Disease Control, started other form of messaging, one of which is first to translate again in local languages, and using three levels of engagement: traditional rulers, religious leaders, our community mobilization officers using handheld loudspeakers going from village to village, street to street, market to market, motor park to motor park, to create more than the awareness, but the consciousness among Nigerians that this disease has come to stay with us. It has manifested in this manner. The fatalities are rising, so also are the levels of also the afflictions. So citizens will have to begin to take personal responsibility to protect themselves, and in the process protect others.
Dr. Barry, I must quickly come in. This is because we just have a few moments before we wrap up, and there is that awareness. There have been several surveys that talk about how many Nigerians are aware of COVID-19, but they also believe, a lot of them believe that they can't get it. Some people still say perhaps it's malaria in disguise, and some others are saying they don't know someone who knows someone that knows someone else that has COVID-19. So these are peculiar challenges. How is the NOA addressing that? And this is coupled with what the PTF is reporting, the low sample collection. So many people aren't going to test, and we're not meeting our daily testing capacity. If you can summarize that in about a minute.
Oh, okay, fine. I think the first thing to do now is to appreciate, and which of course even you, the members of the media, have done that we have a hot potato in our hands. Here is a disease that is real, unfortunately, with a large chunk of our citizens actually living in denial. Now, the first thing to do in order to make sure that citizens do not actually fall victim of their own inadequacies as far as prevention and the risk communication measures, especially the observing of the protocols are concerned, the prevention protocols are concerned, is for citizens to take particular interest in personal responsibility. Two, also for all agencies, especially the health agencies, to expand the scope of the testing, Because unless you test, you will not see. And because the testing capacity has not actually, because citizens are very responding, because they have not been showing up, because they don't go to the clinics. The testing rate actually tends to drop, and because it has dropped, so also are the indications that the disease is actually no longer on us, or it is not as fatal as we have always created it to be.
All right. Well, I'd like to thank you. I wish you all the best in your advocacy and sensitization on this pandemic. Dr. Gaba Barry, the DG, National Orientation Agency, thank you for joining us on the program.
You're welcome. Thank you.
Italian media has reported that Italy's former Prime Minister Silvio Berlusconi has been diagnosed with early stages of double pneumonia. This is after testing positive to the coronavirus. Double or bilateral pneumonia affects both lungs and can make breathing difficult. The condition has been seen in many cases of patients that have been hospitalized with COVID-19. Here's more on our global update.
The World Health Organization says it does not expect widespread vaccinations against COVID-19 until the middle of next year, stressing the importance of rigorous checks on their effectiveness and safety.
This phase 3 must take longer because you need to see how truly protective the vaccine is. You also need to see how safe it is. You need to understand whether there are things that there are earlier phases, you do look at safety, and you look at safety very, very carefully before you go into the phase 3. But you need to be following safety at all stages. So that makes it a longer process.
The WHO says none of the candidate vaccines in advanced clinical trials so far has demonstrated a clear signal of efficacy at the level of at least 50% sought by the agency. Meanwhile, according to the research published in The Lancet, patients involved in early tests of Russia's coronavirus vaccine developed antibodies with no serious adverse events. But experts say the trials were too small to prove safety and effectiveness. Russia granted regulatory approval to the COVID-19 vaccine in August after less than 2 months of human testing. In Asia, Japan's government says it will bear the cost of providing coronavirus vaccines to its populace as it aims for a comprehensive inoculation against the pandemic. The government also says it plans to establish funds to compensate for possible side effects from vaccines. In other developments, New Zealand has recorded its first coronavirus death in more than 3 months after a man in his 50s succumbed to the virus. Health officials say the man was part of a second wave cluster of infections that emerged in Auckland last month, ending a spell of 102 days free of community transmission in the South Pacific nation. And in Europe, France has closed 22 schools following the resumption of in-person classes this week because of a surge in coronavirus infections. The country's education minister says overall, French schools have reported about 250 suspected virus cases per day since they started reopening on Tuesday.
Grazie ancora.
Italy's former Prime Minister Silvio Berlusconi is in hospital in Milan with early-stage double pneumonia after testing positive for coronavirus. The 83-year-old, who underwent a major heart surgery 4 years ago and halted all public appearances after the coronavirus pandemic hit Italy in February, says he feels fine.
Well, the weekend is here. Take responsibility and stay safe. Don't forget to take further look at our website, channelstv.com. It has more updates on the pandemic. There are several other stories there for you as well. That's channelstv.com. Thank you for watching the program. I'm Millicent Walker. Stay healthy.